Welcome to Finding Home, a podcast about life, change, and what it really means to feel at home here at St. John's United. This is where we share real stories about what life is like in senior living. You'll hear from residents, their families, and the staff who support them. If you're thinking about a move for yourself, someone you love, or just want to know what life here is really like, these conversations offer honesty, advice, and reflections on what it means to be welcomed into a community that's here for you through one of life's more unexpected and challenging changes, finding a new place to call home. Because at St. John's United, home isn't just a place. It's the people and the moments that make life worth living. And there is so much life to live. I'm Erin, your host, an occupational therapy student working with St. John's United. Today, I'm joined by Juanita, daughter of a resident in a St. John's assisted living community, who's here to share her story about helping her father move into senior living and all the life in between. Good morning, Juanita. Welcome.
Good morning.
Thank you for being here today.
Thanks for having me.
Absolutely. So let's get to know a little bit about yourself. Where you're from?
I spent my childhood going back and forth between Lewistown, Montana, and the family ranch.
Awesome.
Dad raised cattle out there, so I got to grow up living the dream, living out in the country. And then I moved to Billings to attend Eastern Montana College. It's now MSUB, and I got a bachelor's degree in business administration and communications. And I liked Billings so much that I just ended up staying here. So I've been here ever since.
What do you do now for work?
Right now, my husband and I own 4 houses next to ours, little houses, and we furnish them and rent them out to traveling professionals. So I just manage the rentals.
That's a full-time job. I can only imagine.
It is. It is. The yard work is a lot of work, but I really enjoy it.
Fair. And great place to do that in Billings with all the healthcare and the things that are here in town. Lots of people needing those furnished rentals.
Exactly. We started furnishing them during COVID, and the nurses would come and stay in our rentals, so it just worked out perfectly.
Beautiful. Doing your part.
Yeah.
During a crazy time in our lives, for sure.
Yeah.
Well, when you don't have, or when you're not managing all your rentals and taking care of multiple homes, what do you like to do in your free time?
I really just enjoy staying at home. I like doing my gardening, reading. I love to listen to audiobooks and play with our dogs. We have 3 little dogs, and they're just my little babies.
Fun. How did your garden do this summer season?
Pretty good. Good. I did a little bit less than I have in the past because I spent a lot of time with my dad, getting him all moved and taken care of. But yeah, it was a good summer.
Absolutely. Well, speaking of your dad, let's talk a little bit about the transition you guys have made into senior living and kind of what that has looked like for you.
Well, Dad was living alone in his home and doing pretty good, going to eat at the Council on Aging regularly. But then he had a medical issue. I got a phone call from his cleaning lady saying that she'd taken him to the emergency room. That ended up with him getting sent to Billings and an extended stay in the hospital here in Billings. And it all ended with him needing to move into an assisted living facility.
Gotcha. And you guys spent a lot of time in the hospital.
We did.
With him, it sounds like. Okay.
We did. He was in the hospital for 13 days after he got to Billings, in and out of ICU. It was a pretty serious situation. And then after the hospital, they discharged him to a transitional care facility, transitional rehab. So he was there for another 22 days.
Wow. So this has been a long haul getting here.
It really has.
Oh my gosh.
It really has. And now he's doing so much better. But it's been a long summer.
Absolutely. Well, thank you for taking the time to have this conversation with me amongst all the other things in life you have going on. So you had mentioned that you guys handled POA paperwork prior to hospitalization. Is that correct?
Yes.
Okay.
Yes, we had all of that all taken care of. And I'm really glad that we did because that gave me ability to make the decisions and answer the questions at the hospital. He wouldn't have been able to do it himself. So I'm glad that we had all of that taken care of beforehand.
Was a move into senior living a conversation you had with your dad prior to this health event that occurred?
No,
Okay.
No, we didn't have that conversation. And in all honesty, I wish we had. I just had to make a lot of decisions, and I would have felt a lot more comfortable having had that conversation in advance and knowing what he wanted. Um, but since we hadn't done that, I just had to do what I felt was best.
Sure. That's a tough situation to have with any one of your family members and loved ones.
It
It's,
is.
yeah, no one wants to kind of think about that next step. Um, but you got to have those conversations because it's
Yes.
part of being human.
Yes. And I also think it would have been very nice to have had the conversation about what to do with his house and all
Mm,
the stuff. It's been difficult to have to make all those decisions. And if a person has a certain thing that they want to go to a certain person, I think it's really important to get that written down so that the person who's doing all of the work knows where you want these things to go, because I don't know, and sometimes I'm just making my best guess now at this point.
yeah, that adds a lot of stress and other things to your already full plate, it sounds
Right,
like.
right.
Yeah, your dad's lucky to have you making those decisions with and for him now, for sure.
Mhm.
Yes. So going back to the time that your dad was in the hospital, you mentioned transitional care. And then from that point, was it a conversation of like, is he going to go home or is he going to move into assisted living?
When he first went to transitional care, the hope was, and the initial plan was that when he left there, he would be able to move into one of my furnished rentals.
Gotcha.
That would have been absolutely perfect. It would have been right next door to me. I could have taken care of him. But as the time that he was leaving rehab came nearer, we realized that he would need more care than I was able to do, even if we had home health care coming in. So that's when we made the decision that we'd have to find an assisted living place rather than moving into one of my rentals. And case manager at St. John's Transitional Rehab was very helpful in making that decision. She gave me a list of facilities that had availability, and I was able to go there and tour the facilities and talk to the people and get an idea of what they offered, what they didn't offer, and make an informed decision. So that was very helpful.
Great. I love that you took the time to do that and that St. John's supplied those resources because it's a big investment, among other things, to make that move.
Oh, it is. It
Hmm.
is. And a lot of things that I'd never even thought about.
Yeah.
Yeah, and they're all a little bit different. They all do pricing different. Yeah, so it was nice to have that help.
What was it about the St. John's facility that your dad's currently in that sold you? Like,
Well, they had a bed.
oh, good.
That was one big thing. They
Uh-huh.
had availability. Um, I really liked that the way they did the pricing. They could just give me an amount and say, "This is how much it's going to cost."
Hmm.
And that will include all of the care that he needs. The other place that I went to, they give you an amount, and then any additional little bit of care that they did was an additional fee.
Wow.
So I really didn't know how much it was going to cost. You know, if you need help with medicine, there's another $100. If you need help with food, here's another $100. It just kept
Yeah.
adding on, and I wasn't comfortable with that. Another thing that I really liked about this facility at St. John's is it was smaller. It was more of a not really family atmosphere, but a smaller, less overwhelming facility. Everybody knows each other. People eat together at tables in more of a family setting.
Nice.
Yes, yes. I really liked that. I got to see the staff, and they were all very helpful and appeared to be happy and enjoying their job. I also was impressed that the residents and the people that lived there were all happy.
It says a lot talking to
It,
the people that live it every day.
yes, yes. And honestly, I wasn't expecting them to say that they liked it, but they did. So that says a lot for the facility.
And I think that's totally fair. There tends to be a stigma about senior living, long-term care, whatever you want to call it, that a
Right.
lot of people they steer clear because it's scary and you hear all these horror stories, but it's not always the case.
No, no, it really isn't. What I've seen so far, it's very nice. It's a safe place. He knows that he's getting his medicine when he needs it. Um, and the food is just really good.
Yeah.
Just amazing. The grounds are amazing. It's just a really nice environment.
When your dad discharged from transitional rehab, did he immediately move into a room at this assisted living, or was there a waiting period?
Um, that's another thing that was really helpful. They had what they called a respite room.
Okay.
So it was in the facility. It was in a very convenient location, probably the nicest location in the whole place. Right next to the eating area, with just a beautiful view out the window, but it was completely furnished.
Oh,
So we were able to just move him into a completely furnished room. And that gave him time to get used to it. And it gave me time to do all of the things that I needed to do to get him the stuff that he would need in his room. So, because I had to get a bed, I had to bring furniture from Lewistown, I had to get all new bedding.
yeah.
Yeah. So it gave us that little bit of time to do that. And then once I was all ready, then we could just move him into a permanent room with all of his own comfortable belongings.
That is fantastic. Having that time to transition peacefully ish. I know it still sounds like it was crazy and you're kind of scrambling to do things.
Oh
Oh
yes.
boy, yeah.
Yeah.
I can't even imagine.
We were, but that gave us a little bit of breathing room, and that was really nice. Yeah.
That's what I really like about your story is you guys didn't have the time to plan like some folks do before, they move into Mission Ridge, then they go to assisted and kind of follow that care continuum. But for you guys, it was a little bit of a different experience, but still overall positive. It sounds like dad has the care he needs and you had the support from the St. John's staff to make that move.
Yes, yes.
Good.
In hindsight, it really did go as well as it possibly could have gone.
Good.
Because like you said, we didn't have any real plan in place. We waited until there was an emergency, and then just had to go from there. And like I said, I think it went as smoothly as it possibly could have gone. And the St. John's team was very helpful in
Mhm.
in making that happen.
Good. I'm glad they took care of you.
Yeah.
Yes. I think maybe, I don't know if it's Montana rural living, but it seems to be that a lot of folks appreciate where they're living in that smaller town or that rural community that they've grown up in, and then moving into senior living or some sort of different care level is scary. And it's just not a conversation they want to have or you think about.
Right.
Hmm.
I agree.
Yeah.
Moving to a bigger community is just scary in
Yeah.
itself. The traffic and all the people and leaving your familiar little home and all the people it's the whole thing is scary.
Absolutely.
Yeah.
You lose because occupational therapy is my background, you lose a lot of the meaningful activities and purposeful activities. Like for your dad, I bet he found a lot of meaning through raising the cattle and caring for a farm. So
Mhm.
now transitioning into a place where there's no cattle to feed, we don't have cows on the property. He's having to find different ways to fill his time and find that same purposeful enjoyment in life. It's scary.
Yes, yes, it is. It is. The at St. John's they make a real effort to have activities and things to do to keep people involved and active and to create those social connections. I think that it really helps if you have something to do with someone. It helps you to get to know them.
Hmm.
Um, so I think that has helped in that transition. But you're right; it's a big change.
We're going to kind of segue into this next portion advice for others. But now that you've lived this crazy move into senior living and survived, what advice would you give to others? Maybe it's a daughter moving in a father, or maybe the resident themselves. What would you share with them to make their transition into senior living a little bit easier?
Well, first of all, I think we've kind of already talked about this, but have those difficult conversations in advance. I think it would have been easier for everyone if we had talked about in advance. Everyone gets older. When you get older, if something happens, if you need additional care, what kind of care do you want? Where do you want to go? What kind of place do you want to live in? What town do you want to live in? How do you want us to deal with your home? Those kind of things. It just would have really helped to have talked about that in advance. As far as once he's at the facility, I think that something that has really helped a lot, and that I'm lucky enough that I have the time that I'm able to do it, is spending time at the facility with him. Especially when Dad first moved in, I was there every day to eat with him. Not every meal, but several meals.
Yeah.
Get to know the people, talk to the people. I participated in the activities with everyone. It made me feel more comfortable with the facility, and it helped him to get to know them. Instead of just being all on his own, I can say, "Hi, I'm Juanita. This is my dad." And it just helped us all. Another thing that I think is very important is to go to the doctor's appointments. Doctor's appointments are hard for anybody.
Yeah.
But they're especially hard when you're a little bit confused and you're not feeling well. And doctors are always in a big hurry. And I think it's very helpful to have another person there with you to make sure that you hear and understand everything that's going on, and make sure that you have the ability to tell the doctor everything that you want to tell them. So I think it's very important that you go to all those different appointments. That's one thing that he'd gotten a little bit behind on all the different appointments. So and because he's moving to a new community, we have a new dentist, a new eye doctor, new everything.
Oh gosh, yeah, I didn't even think about that.
Yeah, new primary care physician, everything is new. So there are a lot of appointments. This way I'm getting to know all these people from the very beginning. I think that's very important. I would suggest everyone do that.
Absolutely. I like that. And you take the time to do that because maybe some folks wouldn't think about it. Dad's there, he's taken care of, the CNA will go with him.
Yeah.
He's fine. But you being there, I think, speaks volumes.
Yes. That is one thing. St. John's does offer transportation. They take the residents to any appointments that they need to go to. So if I wasn't able to, they would take him there. Another thing that they do that's really helpful is they keep track of all the appointments. Even though I'm going, they keep track of them. And when we leave, they hand us an envelope with a list of all of his medications.
Wow.
Yes. And so they give us all of his information that we need to give to the doctor. They have it all ready for me. And they just hand it to me. Or if I wasn't going, they just hand it to him. And then he can just give it to the doctor. And there's a spot on there for the doctor to write any new prescriptions, the outcome of the appointment, any information. And then we bring it back and give it back to them at St. John's so they keep all of that information.
That is beautiful. I had no idea. Thank you for sharing that little tidbit.
It's very helpful.
Wow, and probably takes a little bit of a mental load off of you. So you're not scrambling, what the heck is my dad taking and where's our paperwork? And
Exactly. I remember, trying to help him out with doctor's appointments before we had St. John's, and it was really confusing. They said, what kind of medicine does he take? And I don't know. What time does he take this? What time does he take that? And this way we have it all written out. I can just hand him the piece of paper.
That's fantastic. You can't ask for anything better.
It is. It's very nice, especially since we're starting all new providers, because every provider wants that information.
Of course. Fair. Going back to your point about spending time at the facility with your loved one, I think you just preached it, but you also practice it. I remember seeing you know the name of every resident. You're going to activities with your dad. There's been comments about this resident and his daughter are working on, a certain project together. Like the residents know you. You've kind of become part of their community quickly. And I think that says a lot about like how invested you are in taking care of your dad and doing all the things. And I can't imagine it's easy to come and spend all that time because you've got your own life, but I truly admire it, Juanita.
Oh, thank you. You're welcome. Yes, it's not easy, but honestly, it really is a nice place to spend time. And I really do enjoy the other residents. I enjoy walking in and saying hi to them and having them say hi to me. And I think they enjoy seeing somebody different.
Yeah.
Yeah.
I agree. Well, I'm glad you're part of their little community.
Thanks.
Yes. So your advice for all our folks, I think it's beautiful. Go spend time with your loved one, go to doctor's appointments, and then have those tough conversations. I think it's really good advice. I hope that some people can listen to your story and learn a little bit, and maybe it'll help them make that change when they need to and when they can.
Yeah.
Yeah. Well, thank you for being here today and taking time out of your busy landlord, taking care of dad's schedule and dogs and gardening. Yes. Awesome. Well, thanks again, Juanita.
All right. Thank you.
Thanks for spending time with us here on Finding Home. If you enjoyed this conversation or thought of someone who might connect with it, we would love for you to share it with them. Every episode tells a different story about what it's like to find home when life changes, and we hope you'll listen to the others and be part of the journey with us. Special thank you to Rock 31, the team at Big Sky Economic Development, and St. John's United for making this project possible. Cheers to living life wherever you call home.